What we know is that many of our patients are under very, very significant amounts of intensive care. Sometimes that involves a long time in a hospital bed. Sometimes that puts the heel at a great deal of risk. What is really exciting is that part of the Woundcare-Circle algorithm includes a direct therapy for protecting and healing these heel ulcers. I don't know of any other area that has really focused on this more. And what is really particularly exciting is that we have products now like this that can be customized and are almost bespoke to an individual patient. And they're really, I'm not aware of any other products that really focus on an entire line regarding the heel and protecting the heel, like the heel lift products. Something that's particularly exciting to us is that we now have a product like the Body Armor Pro Term, which is something customized and specifically designed for proximal midfoot amputations. This has never existed before, because now for these real salvage procedures, we can protect the foot in the most comprehensive way possible. And we can get people immediately into rehabilitation, often with other devices on them, like negative pressure wound therapy and other things like this, and then get them rapidly into rehabilitation, into occupational therapy, and into living their life. This is something of a game changer for these very complex salvage procedures, often in patients who need to get out of bed. Because if they don't get out of bed soon, they're not going to get out of bed later. We have known for a long time that it's not what you put on these wounds that heals them, but what you take off. And if you appropriately debride a wound, meaning you appropriately keep it clean and remove dead tissue, and you appropriately take off the pressure, meaning you distribute force over a larger area, many of these wounds are going to heal in the face of good blood flow. The trouble that we have seen, and it's a big unmet need, is that people have focused on other kinds of technology to try to heal these wounds, but not the most basic thing, which is to protect the foot. What is particularly exciting about the Optima Molitor line of products and the Woundcare-Circle algorithm in general is that there are evidence-based technologies to offload the foot and the wound in its most acute phase, and you have a device like this that is not only evidence-based, but it is so customizable now. It's almost like a Swiss Army knife for offloading and healing. The amount of flexibility that we have is quite extraordinary. And then after the patient heals, where do we go? Well, once a patient is healed, they're not healed. They're in remission. And we like to use this term because at 1 year, about 40% of people are going to develop another wound. That's 2/3 at 3 years, almost 3/4 at 5 years, and between 80 and 100% at 10 years. So our goal really should not be to prevent recurrence, even though that's a laudable goal, but our goal really should be to prevent severe recurrence and to make those recurrences as minor as possible. The way to do that is to have them in shoes that they want to wear, or that our patients want to wear. And the biggest problem in the past has been that these shoes for our patients in remission and for other risk categories have been ugly. And so our patients often will look at them and they'll say, they'll just want to throw them away. What is exciting for those of us that have been in this area for a long time is now we have technologies that can protect the foot and allow improved activity for all classes of risk. And that's what we're seeing now with technologies like the Optima line of footwear. So you can go all the way from something like this, a shoe to reduce the risk for occurrence or recurrence of a wound, to something like this, which is robust to offload and to heal a wound, all in one line of offloading and healing products. It's really a line designed not only to heal people, but really to prolong a higher quality of life. And I think that's what we all deserve, and I think that's what our patients deserve, and now that is being provided for them. So I couldn't be more enthusiastic. So in the past, our efforts to protect the feet have been hit and miss. We've had products designed to prevent occurrence of wounds. We've had products designed to prevent recurrence of wounds. We have had products designed to treat acute wounds on the bottom of the foot, on the back of the foot in the heel, for patients with various levels of amputation. But no one has thought to come together and to put it all together in one algorithm and one circle of care, one continuum of care. What is laudable, and I think what should be, I think that there's a lot of, I think we should compliment members of industry now, different companies that have come together with this Woundcare-Circle algorithm to have an alpha to omega, an A to Z strategy, where we can have a variety of technologies, from something to protect the heel in a very sick patient, all the way to something that can promote daily activity for patients who want to get out and live their life, either to reduce the risk of further complications. Because again, I think that's what we all deserve, no matter what our health and no matter what our age.